So if we open the heart, if we were to look inside the heart, so this is the heart open, you'll find that the heart has got four chambers: the left atrium, the left ventricle on the left side, and the right ventricle and right atrium on the right side. And separating these chambers and also separating the big blood vessels which come out of the heart are valves. So we have here the mitral valve, which separates the essentially separating the heart from the lungs. It separates the left ventricle from the left atrium. Then we have got the aortic valve, which essentially separates the heart from the rest of the body. The aortic valve separates the left ventricle from the aorta. Then on the right side, you've got the tricuspid valve, which separates the right ventricle from the right atrium. And then we have the pulmonary valve, which separates the right ventricle from the pulmonary arteries. So things can go wrong with any of these valves. These valves can start leaking, and then, or it may get very narrow, so it doesn't opening properly, and blood is unable to flow through it. So if we go through, first of all, through to mitral regurgitation, which essentially means a leakage of the mitral valve, which separates the heart from the rest of the body. So this is the mitral valve. The mitral valve is essentially like two doors, and the two doors have to close at exactly the right place. If one door closes too much or goes in the opposite direction, as in shown in this condition, then there is a space here which results in blood leaking in the opposite direction. So one of the things that can go wrong is that the supporting structure which supports this valve can rupture. And this can happen, for example, just due to wear and tear with old age. And if this happens, then blood will then leak in the opposite direction, what we call mitral regurgitation. Another condition which can happen is that there may be too much tissue. The door may be too big, so that when it closes, it doesn't close at the right place. So there are some gaps in between the two doors, and then blood leaks as a result. So this is mitral regurgitation. The mitral valve can also leak due to weaknesses in the heart muscle. So after a heart attack, for example, if the heart is not contracting very well, or if it is getting bigger, then it can pull the valve apart like we see here. And this can result in a leakage as well, what we call ischemic mitral regurgitation. So the symptoms in this condition, patients get short of breath. They may get palpitations because over time, if it is left untreated, the patients typically develop an irregular heartbeat called atrial fibrillation, and they may also develop ankle swelling. So to diagnose this condition, we will do a heart scan, what we call an echocardiogram, which is essentially an ultrasound scan of the heart. We put some jelly on your chest wall, and then we pass the ultrasound probe on it. And this is an example of a patient. You can see this is the mitral valve. And you can see this bit here. This bit is one of the supporting structure of the mitral valve, which has ruptured. And so you can see this jet, this yellow jet is the leak. So blood is going in the opposite direction where it shouldn't be going. And because of that, it has caused this patient to get more short of breath. So the aim of treatment in this condition is firstly to improve the symptoms. Patients typically get short of breath and are unable to do what they normally like to do. So one of the aims of treatment is to restore their quality of life back to what it normally is. And then of course to improve their survival back to normal, and also to reduce hospital admissions, to avoid patients needing to come into hospital because of heart failure. So there are various treatment options for these conditions. If the leakage is just mild or moderate in severity, then most of these cases can be treated with some medications just to get rid of excess fluid or to improve the heart function a bit. But if the leak is severe, then surgery will be needed because this is a mechanical problem. and surgery to repair the mitral valve is the best option. And if it is not possible to repair the mitral valve, then surgery to replace the mitral valve would be the recommended treatment. So if we look at what happens to patients, if we just treat this condition with medication and just don't do surgery, just leave it alone, over 10 years, you can see that 30% have developed what is called atrial fibrillation, which is an irregular heartbeat. So then they would need to go on blood thinning medications, and this would affect also their quality of life. And then 60% would have gone into congestive heart failure. So they will have difficulty with breathing. They are unable to do most of the things which they normally like to do. 80% of the patients would have had needed surgery, and 90% of the patients would have either died or have needed surgery. So in other words, this is a condition in which surgery will be needed within 10 years. Because it is a mechanical problem, medication has only a limited role in terms of treating this condition. But we now know that the earlier we do surgery, the better the survival for the patient, the longer the patient will live if we do the surgery earlier. So we can see from this study that over 20 years, those patients who had surgery when they had no symptoms, so they were still quite well, but we had diagnosed that they had a severe leakage of the mitral valve. If we did surgery at that stage, they lived the longest compared to patients who had surgery when they had mild symptoms, and patients who waited until the symptoms were very severe and then only at that stage had surgery. Those patients did not live as long. So with this condition, the earlier the surgery is done, the better. And that is because if we do surgery early, the heart is still strong and had not got bigger. And so, in fact, if we do surgery early, we will restore the life expectancy of these patients back towards normal, back towards a normal, healthy individual. And we now also know that if we're able to repair the mitral valve, this is much better than replacing the mitral valve, because the patients who had a valve repair again live longer compared to those who have the valve replaced. And this is because it is all your own tissue and there's nothing artificial in it. In fact, you can see from this study that those patients who had mitral valve repair live the same as those who had no underlying heart condition. So in other words, we are able to restore the life expectancy of the patient back to a normal individual, back to a normal healthy patient following a mitral valve repair surgery. There are various techniques to repair the mitral valve, and this is one of them. So in this case, we are putting in new cords or new supporting structures to re-support the mitral valve, what we call a neo-chordae mitral valve repair. And this is what we would typically do if the problem is one of the cords had ruptured, one of the supporting chordae had ruptured. In those who have too much leaflet tissue, we can repair the mitral valve by leaflet resection. So we resect the excess leaflet tissue so that the two leaflets of the mitral valve would then close at the same place and stop the leakage. And in addition, if the annulus is big, then we can suture an annuloplasty ring or a new door frame onto the valve to restore its normal shape and size. We normally do this anyway in most cases of mitral valve repair to stabilize the mitral, what we call the mitral annulus or the frame of the mitral valve. So the take-home message for mitral regurgitation, patients with severe mitral regurgitation will benefit from surgery. The earlier the surgery is performed, the better the survival. Mitral valve repair is better than valve replacement whenever this is possible. In most cases of degenerative mitral regurgitation, in 95% of cases where the problem is wear and tear of a ruptured cord, for example, in most of these cases, we can successfully repair the mitral valve and there is no need to replace the mitral valve. But in cases due to what we call rheumatic heart disease, where the mitral valve is very diseased, is very what we call fibrosed and narrowed, then we may need to replace the mitral valve in those cases. So this is a book I've written. You could read that if you're interested, but it's written for doctors, so you would need some basic understanding of medicine and the heart to understand it. But if you're interested, everything I've said is in this book, which has been published. I'd like to thank you again for joining us today, and thank you to CVSKL and to our supporting partners for arranging this webinar. I hope it's been useful and interesting, and I will be happy to answer questions. Thank you.